Hidden in the grounds of University College Dublin lies Ireland's premier veterinary hospital. Each year it sees some 6,000 animals, and for many this is their last hope to get better.
Oh, Kat, you better breathe.
Never before in our history have animals taken such a prominent role in people's lives.
He doesn't like men.
And here, owners hope that cutting-edge technology and veterinary expertise can save the animal that they have grown to love and depend on.
All right, it's okay.
She's my life.
Seems to be trying really hard to get air into his lungs.
I know, sweetheart.
The ability to offer advanced surgical techniques, extend survival, improve quality of life for these patients, that's enough to get me up every day.
Let's go, yes!
Welcome to Animal Emergency.
Yes, good girl!
I love animals. I mean, since I was a child, I just had this graw for animals. So a few years ago, I moved up the Dublin Mountains. It's just heaven up there. And I started off with 2 goats. I now have 24 goats. I've got pigs, I've got emus, I've got llamas, I've got pygmy donkeys. Neighbours think I'm nuts. They're probably right. I got 4 pigs from the same litter. I kept a boy and a girl, and my close friend kept another boy and a girl. I suppose what was attractive about the coons is that they stay really, really small. They're the smallest breed in the world. They're unbelievable at finding food. They've just been amazing, and everybody who sees them just falls in love with them. There's just something very charismatic about pigs.
In the vet hospital's large animal yard, Keelan has brought in 2 of the coon pigs to be castrated today. Pigs are known for their intelligence, and maybe Joey had a premonition of what was to come. He briefly escaped from the van on the journey to today's castration.
This is Joey Houdini. This is the one that got out of the back of the van, crossing the Dublin Mountains. I have brought everything from emus to donkeys to alpacas, and nothing has got out of that van. You did, didn't you? You sure did. What happened, I will never know. But when I opened the back door, lo and behold, Joey had vanished out the back of the van. And it turns out we panicked and drove right back over the hill and found Joey on the road. And he had managed to jump up and pull down the lever and push the door out. Here he was trotting up the road, not a bother on him. This is Hank because he's a tank. He's a really strong fella, this fella. He's got real attitude. So, Hank the Tank and Joey Houdini. Isn't that right?
Pigs are, I suppose pigs are like dogs. They're so smart.
Yeah. No, it's not so bad. Sure it's not.
But I do find myself quite often sitting down in the pig pen, especially when they're pets and they come up to you and they want attention, and those pigs they were adorable.
Keelan has a special bond with the pigs. He's worried about them going under the knife.
It's funny, I thought that they were going to get done same day, and we've just been told they have to stay here for 6 days, which probably makes it feel a lot more serious because apparently it's quite a serious operation and they'll have quite a big wound. So a little bit more fearful, I suppose, now that I realise it's just such a big procedure rather than a small job. And we just rang their mammy to tell them they wouldn't be coming home, and she was in tears on the phone. So yeah, it's going to be a hard few days. And I promise you're in good hands. And I promise I'll be back to collect you soon. All right? You take care. All right? I'm going to miss you. Yeah.
Duke is a clown, so most pugs are clowns, but this fella is a pure gentleman. He just wants to please and to be a good boy. Everything is about being a good boy. He's 100% ruined. He sleeps in the bed with me. I'm an awful fool. My husband snores, the dog in the middle snores, and I snore, so it's some music going on in our house at night. I'm on the edge of the bed and the husband's on the edge of the bed so that this little prince can be comfortable. Absolutely ruined. Yeah, absolutely ruined.
Bernadette and her dog Sapphire are waiting to be seen in the vet hospital reception. Sapphire hasn't been feeling well for months and so has been referred here by her vet after multiple tests.
She is 9. In fact, she's almost 10. I'm kind of in denial. And she's taken such a turn. You know, I do fear that things don't look good for her at all. It's just like, you know, it was like she had this sudden, rapid ageing process that just sort of started, as well as the drinking, and overnight she just went from being perfectly well to being just all really unwell in herself. I mean, definitely, obviously, her energy is really, really, really down. We bring her out for a walk. She cannot walk up steps. She can walk down steps, no problem, but she can't walk up, so we have to carry her.
Bernadette and her family were determined to have a dog like Sapphire after being inspired by a film over a decade ago.
I have 2 daughters who are sort of late teens, early 20s now, and about 10 or 11 years ago, they saw this movie called Hachiko. It's a very famous movie. And it's about the 2 stars are a Shiba Inu dog, and Richard Gere is the other star. We'd never heard of a Shiba Inu before, and for anybody who doesn't know, they are like the absolute common everyday dog in Japan. They're very unusual still in Europe. They look like a really well looked after pet fox. They have this incredible, it's almost like a yodel, it's hard to explain. It's a really high-pitched wolf sound. Yeah, they come partly from the wolf family. So we went on a hunt for a Shiba Inu, and there was one breeder in Ireland, and she was a very good breeder and adored her dogs. And as it happens, my 2 girls are adopted. I adopted them in China, and I can tell you it was nearly harder to get this Shiba Inu off this breeder than it was for me to adopt my 2 daughters. Oh my God, we had to go through so many hoops to satisfy her. But anyway, we got her, and Abby called her Sapphire. They're much more like cats than dogs because they're extremely independent, and unlike most dogs, they set out not to please you. You know, if you go to bring them for a walk and get out the lead, they'll go and hide under the bed, even though they really want to walk, and they just do everything to thwart you and play mind games.
The lead vet looking after Sapphire today is Irene.
It's quite nice. I don't know, this office has a nice vibe. I grew up having multiple different animals. I cried a lot when my hamster died, and I made a funeral and made all my girlfriends come.
That's not weird at all. No.
They had to wear black clothes, and we had to put fake tears in our faces because everyone had to cry for my hamster.
It is why, sweetheart.
I'm hopeful that there is a lot to be done for Sapphire. I know it can be frustrating, and I think it's very important for the owners to keep the faith and be patient and have faith in the diagnostic process. What do you think about her abdomen, abdominal palpation?
Her abdomen is a bit tendulous.
I think we can easily press our little hands in it.
Irene has a daunting task, trying to figure out what's caused Sapphire's mysterious decline.
If I said to you, tell me, how do you love your children? You'd probably be stuck for words. So in a way, it's a bit like that. I mean, people would think you are crackers, but there isn't that much difference. I mean, I adore the dog. I obviously adore my children, and obviously they come first. Just a huge character, and we all love her. I mean, just can't imagine being without her.
If we find a disease that is curable, or at least treatable, I should say, there is hope. So I'm certainly hopeful for the future.
Hank and Joey are due to be castrated today, and to add insult to injury, they have to fast.
They weren't allowed any breakfast, which they did not like. We sedate them in their pen to try and keep everything as relaxed as possible. If you try and restrain them for someone to put a big needle into them, they're not stupid animals. Like, they know that that's going to happen. So what we do is we get our needle and we attach it to a really long extension line, and we have our drugs in a syringe on the end. and you sort of are able to distract them. These guys loved being rubbed and cuddled, so we did that, and then slyly put our needle in. There was a little squeal.
Yes, Peggy.
And a little run around, but because we had that long extension line attached, we were just able to inject as he was going around the pen, and he relaxed very quickly. Joey was also meant to have the same procedure. He actually only had one testicle present, so in that case we leave them until they're a little bit older.
There's only one. We have to wait.
However, Hank was more than ready to go, so we were able to proceed with him.
Apparently they can get a hernia from the castration. It's general anaesthetic. It's quite a large wound, and it's a very difficult procedure that can have serious repercussions.
Okay, team Hank, we're good to go to later. Or knockdown box rather. No Peggy, you stay there.
Checking into the vet hospital reception are 5-year-old Shih Tzu Oscar and his owners Jason and Martha.
Oscar, if you want,
Oscar rules the roost in the Mooney household, but it wasn't always that way.
I didn't really like Oscar at first, and after
You didn't like his name either?
Her father got him as a present for her. I didn't want to hassle the dog because we were renting the house at the time.
Well, we didn't know. My father just said, there's a lovely little dog up there, would you be interested in having a dog? And we kind of said, maybe, yeah. And then he just arrived up the next day with him. So we had to take him then.
When he was a pup, when I was going to work, he'd sneak out in the morning and hide in the back seat of the car, right underneath the seat, until I drive out and lock the gates, and he'd peer out then. He'd put his head over to where you change the gears, and he'd put his head in your arm. He'd want you to hold him.
Spoiled.
It's unbelievable,
You can't go anywhere without him.
If it was a child, it's different. You can get a babysitter, but him, no. If he hears that you're leaving him behind, he knows, he knows by us talking.
And then, if you left him with someone, he'd be pining all day for you. You know, he'd be depressed, going around all day until we come back.
Oscar has a complex history of bladder problems and difficulty with urinating. The issue has flared up again, and his own vet has decided it's time to send him to UCD for further investigation.
We're going to mind you, bud. This time we're going to get you fixed.
We'll make you better.
Yes, so Oscar has had problems passing urine for quite a while, so over a couple of years ago now, and he had surgery at the local vets.
A few months later, he got the same symptoms, but we brought him back and they said it was all scar tissue in his urethra tube. So that's why they gave him the urethrostomy, to make a new opening for him to weave.
Do you want me to lift him up for you?
And unfortunately, despite having all those operations, Oscar was still having problems urinating, and more recently, he was really, really straining, looked really, really uncomfortable.
Some breeds have an increased risk of bladder stones and infections, but Monica will have to investigate all possibilities.
You just know he's in pain.
And he'd go to the toilet and he's waiting 10 minutes nearly to go for a wee, and he's looking at you and you can see he's in terrible pain. And he's straining and
then he's coming back in and he wants to go out again, and it's hard, it's hard to watch. Very hard to watch.
What do you feed him? Like wet food, any special brand?
He was meant to go on the special food, but since he's got sick, he's not eating anything except for sausages.
Sausages?
That's the only thing he
chicken.
eats. A little bit of chicken, but that's... It's the only thing, he'll starve otherwise, you know what I mean?
Okay, and he wouldn't eat a special diet at all?
But he won't eat them, so we'll just have to try maybe when he gets better, hopefully.
He'll starve,
Yeah. Before he was eating, say, maybe boiled chicken and a bit of rice and maybe a couple of carrots or something, a bit of broccoli.
He'd eat carrots, broccoli.
Yeah.
Yeah, he'd eat all...
Human food. He doesn't like dog food, he likes human food.
Whatever you're having for dinner, he'll eat.
And he'll look at his bowl and wait until we're finished. He'll think he'll get something better off us.
Look over. You're coming with us, little buddy.
Bye, Oscar.
Well, he's gone with him, look.
Yeah. I believe he's gone with him.
I'm not a backward look.
No, I know. We thought he wouldn't go with him.
I thought Why? Oh, come here.
Here. Making liars out of us now.
Shiba Inu Sapphire is having a second ultrasound scan to try and understand what's been causing her to be so unwell for the last few months. Bernadette is desperate to understand what's wrong, despite the rising costs.
It is a big financial outlay, and we don't have pet insurance. She's had a lot of tests before this, an ultrasound which was just around 500. Then she had the biopsy a couple of weeks later, and that was 520 something. Before today, I've spent about £2,000 in the last 3 months on her. And then the vet cheerfully said to me the other day, this is not the end, this is the start of a process. So, yeah, it's very expensive, but it's kind of what you do, you know. I don't know what you do, the credit union will be on call if it gets any worse, so. But you can't say no, you know, just can't.
Sapphire has been through a grueling round of tests and scans, but thankfully Irini thinks she has found the root of the problem.
Hello, hi. I just want to give you an update on what we did today with her. We diagnosed Sapphire with an endocrine disease or a hormonal disease that is called Cushing's disease. And what that is an excessive amount of steroids in the blood. Obviously, if that is the case, there is still some way to go. As you said, we need to start treatment and then we need to monitor response to treatment.
Oh, yes, absolutely. No, I'm very pleased that you think you are moving towards a real diagnosis.
She's a very good girl, Sapphire.
Very good girl. So for me, as a family member, I feel great responsibility in caring for these animals because I know for myself how important they were for us. You've been so sweet.
Bye, Sapphire.
He's been very good.
After 3 days and 2 nights at the vet hospital, Sapphire is ready to go home.
So that still has to go on.
Oh, Sophie. Hi. I'm actually still in shock and feeling really sad about it. There's a ton of things wrong with her all of a sudden. I even got my daughter to drive me here because I just felt too upset to drive the car, so... Why aren't you? That's more like it. No, that's more like it. That's more normal. Come on, Safira. We'll just bring her home, be thrilled to have her home, mollycoddle her even more if that's possible, and love her to bits, and then, you know, just see how she goes. But it's not good. She will be put on medication. I've never known anybody with, an animal that had Cushing's. I said I looked it up, but so maybe, she might respond well to treatment, and just to be wonderful if she does.
Your mom's here.
Safira, do you want to stay? You can't afford to stay. It's too expensive. You can't stay here. It's too dear. You have to come home. Come home to Mummy. Come here, you monkey.
Let's hope we'll have a happy ending with this one.
When Vincent first saw his greyhound run 10 years ago, he felt he just had to name her Portia.
I once watched her run parallel to a bus down in the Corker Park, and I reckon she had about 35 miles an hour. She had incredible speed in those days, and that's why any rabbit that appeared here, in seconds she was gone. Lightning. And to watch her, it's like watching David Attenborough's films. The beautiful movement when she runs, This dog is very intuitive. You watch her eyes and you know almost what she's thinking. Or if she comes up and stands in front of me, watch her eyes and the eyes go to the door. And you know straight away, that's how she communicates. So there's a very, very strong bond between us. My late wife, one of the last things she asked me is to make sure I looked after Portia. And I said, well, on one condition, that you come and walk with us every day when we're walking. And she says, I will. So she could be in spirit here as well.
Portia is receiving treatment for thyroid cancer. She had a tumour partially removed by surgery.
The tumour in the throat was very difficult to remove because there's an awful lot of blood vessels there. But she has recovered extremely well from that. The surgeon has recovered as well, I think. I think she found it quite difficult. So it's chemotherapy now.
Knows all the scary stuff, but usually the pets do really well with it.
I'm actually the only veterinary oncologist in Ireland, and I'm specialized in that all I do is treat patients that are going to receive chemotherapy. I lost my dog to cancer, and I got her name tattooed on my wrist. She was diagnosed with a liver mass, and I was actually recommended to euthanize her. And I said, I can't give up on her. You know, she's my best friend. She goes everywhere with me. I continued with treatment, and they told me I didn't have much time with her. I actually lost my brother, and she was there. Sat by my side. And Bailey actually lived for 2 more years.
Now, years later, Amy is doing everything she can to give dogs with cancer, like Portia, more time.
The tumor that she has, it can't be removed completely. We know that there was some cells left behind. I know that it is going to come back, but we know that when we give her this treatment that it's going to, likely double the time that she has without progression of disease.
I love her.
Yes.
I can't get over, like, when I saw her neck, it was like
so swollen.
Yeah, like this is her.
My late wife, who passed away in 2016, she was absolutely mad about the dog. She adored the dog. I think because Angela herself was a very gentle person and the dog was very gentle, I'd be a little bit more robust. Most men are, aren't they? So she was very, very devoted. And even when she was in the hospice, I was able to bring Portia in to see her on one occasion, and she was absolutely delighted to see her and to stroke her, Removal of the thyroid, I would assume, probably gives us a month or 2 more with her. The chemotherapy should actually, hopefully, give us maybe several more months if it's successful.
Hank the coon pig is anaesthetised and ready for his castration.
Okay, so we have the restrainer and the pepper.
As a training hospital, it's an opportunity for some students to get hands-on experience.
They do all of the injections, they do most of the surgeries, obviously not on their own, we're always there with them to help direct them. This is the type of stuff that they're going to be doing when they're graduated in just a few months' time.
So if you want to twist now, yep, lovely, and then bring that in. Okay, so we get going on the second one there.
Pigs can be a little bit difficult under anaesthetic. They do this great thing where they mobilise anaesthetic drugs and will sort of go in and out of sedation. He was being constantly monitored, and whenever he needed top-ups, he was able to get those, and it was a nice and safe procedure.
Hank's castration has been a success, but during recovery, the students notice that something's not right.
His head's going down.
We can make some hot hands for him.
Okay.
Obviously, too low a temperature is not great. That's one of the complications in pigs. They're very good at dropping in temperature during an anaesthetic, which happened to Hank. He did go chilly.
We should be up around sort of 38, 37.5, 38, yeah, 38 cold.
So yeah, I never like seeing a low temperature in an animal.
Although Hank is a pet, pigs can't take certain drugs in case their meat is ever eaten by humans.
Because even though these guys especially, they have names, they're very much pets, they're probably never ever going to go near a dinner plate in their life unless they're eating from it. However, they're still classed as food-producing animals, so we're really limited on the drugs that we can use. There's lots of reversal drugs available for dogs and cats, and we're just not able to use those in food-producing animals, so we just sort of have to wait it out.
In the vet hospital, Oscar's radiograph has shown that the reason urinating is so difficult for him is that he has a large amount of bladder stones. These stones are dangerous, as one could cause a blockage at any point. While Oscar is lightly sedated, a procedure called retropulsion will attempt to lessen the danger by flushing the stones out of the urethra.
Oh, I'm sorry, mister. I'll put the other one as well.
Good. Hey, almost done. Good boy.
All right. Oh.
It's hard to believe. A lot of people won't believe this, but it'd be like one of your kids sick. Like it's he's our family. Like
Yeah. No, it's not going anywhere. Now I blocked urethra further up.
Maybe I can try to.
It is an emergency when it gets the stone passing from the bladder to the urethra, because at some point it will block and obstruct the urethra, so they won't be able to pee completely. It is life-threatening. If you can't really pass urine, yes, you may be able to hold on, not urinating for a day or so, but eventually it causes kidney issues and potentially a bladder rupture.
Well, hopefully those little stones have moved further up a little bit. We'll leave him alone.
Keep him in for a day at least to monitor him and see if he can urine, or what are you going to do?
I think the longer we leave it, the more of a risk of him to be obstructed again.
And given the numbers of stones on the radiographs,
They're quite a lot, so it would be better to keep him in.
The retropulsion procedure hasn't been as successful as Monica would have hoped. While some stones were moved safely, others remain, putting Oscar at risk.
Some bladder stones can be dissolved medically, so on a special diet and sometimes with medications. We didn't really have that time to treat Oscar because he was obviously presenting clinical signs already. So unfortunately, the only way of getting the problem sorted was for Oscar to have a third surgery.
You're such a cutie. I called the client to give him the bad news that his little doggy is staying.
In large animal surgery, Coon pig Hank has been castrated, but his recovery from anaesthetic has been slow, with dropping temperatures.
34.7. Yeah, he's getting lower.
The students were incredibly good. They were very on the ball and grabbing stuff. He did go pretty low, but he stabilised, and once everything was kicked into place, that slowly went up again.
Did you just miss me? Is it the accent? Hey? Oh, hello, baby. No, that's a bit... You're still drunk, sausage. I would do whatever I want. I am a free pig.
Joey is on hand to mind his brother while he recovers, as he's still a bit wobbly on his feet.
This day when I was calling her, no sign of her. So 2 days passed and still no sign of her, and I was really worried. And Brenda and Clodagh, they met a woman walking up the road, and she heard a dog barking down at an old disused quarry, and so she was stuck across this old lake. So it was like 3 days she'd been stuck down there. I didn't think that I would get her back, really. No, she's one of the most important things. Since then, she sticks by me, and she is never not at my side now. Yep, she just means everything, that she's the most loyal, loving dog that you could have. Be lost out, Jack.
Oh, hello. You're the star of the show today.
He loves the
Yes.
Oscar is about to have emergency surgery after the vets discovered that his bladder and urinary tract is full of stones, any one of which could cause a dangerous blockage.
Oscar, get in your pants. You have the best name in the world,
Looking after Oscar today is vet surgeon and Irish wolfhound lover, Barbara.
All of the dogs I've had, well, since I was 17, been giant breed dogs, and I've had St. Bernards, Great Danes, 1 boxer, and 4 Irish Wolfhounds. Oscar kind of landed in our lap. So he was transferred to us to do a sort of an emergency cystotomy, mainly because there was the concern about him potentially obstructing, moving one of the many stones that was in his bladder down into the urethra and basically plugging the urethra from the inside. And that then becomes a dire emergency. So we got him into theater as soon as we could. And usually what we'll do is we open the back of the abdomen, we'll open the bladder itself and get all of the stones out. 1, 2, poor little dog. 3, 11. Ooh, big one, 20. Dog urinary catheter. What was I on to 21? 22? Yes. 22? 23, I don't usually bother to count. 24, these are so nice though. 25. We have to flush in both directions because in male dogs in particular, little stones like to hide in the prostate or in the prostatic urethra. There it goes. Oh, more. Okay. 29, 30. Whoop. What were we up to, 31? Yes. 31. But this is a, medical problem, and they're going to have to get this dog to eat the appropriate diet.
So he's not on any kind of diet already for it?
Apparently he wouldn't eat it.
Oh, that's fine.
But he'll eat it rather than starve to death.
Yeah.
Okay, good.
Oscar's mum, Martha, has been waiting anxiously by the phone.
Oscar's just come out of theatre and he's doing fine.
Oh, brilliant.
He had lots and lots of stones. We counted 33 of them.
Oh my God.
Most of them were in the bladder, but quite a few were down in the in the neck of the bladder or in the first part of the urethra. It's going to be really important to get him, to force him, basically, to eat the special diet.
Yeah, see, we don't want him getting sick again. This is horrible, have to go through this. I'm saying he hates it as well. It's horrible for him, but it's horrible for us to see it as well. So.
Yeah, exactly.
It has been the longest few days ever.
Yeah.
Waiting for phone calls off the vet. That's all we're doing, just waiting for the phone to ring to see how he is. And the house just feels so empty. It's unbelievable. It's like there's like a death in the family with him gone. It's different. I miss him.
Morning, how are you?
Vincent and Portia are back in again for Portia's chemotherapy checkup. Vincent is among a growing number of dog owners who go down the chemotherapy route, determined to do everything they can for their precious pets.
There's a cat out there. Did you hear the cat? Did you? Did you hear the cat? Did you hear the cat? You're a great girl. Do you know that? You're very good. You've been very good.
The kind of mindset of giving a pet chemotherapy has changed over the last 5 years, absolutely. I think a lot of people have that fear that when you give chemo to a pet, they're going to be sick and that they're going to be having, not having any appetite, that they're not going to be able to do the things that they love to do. And that's not what we want at all. So we're not going to cure our patients of their disease. It's very rare that in veterinary medicine that we can cure them from their cancer. What the goal of the chemotherapy is to do is to make them feel better, to have them have an excellent quality of life.
But I know she's on a really good diet. I know how you're feeling.
Yeah, she's good. We have an understanding about
Yes,
She will eat 3/4 of the meal, then she stops. And then she looks out the window. And then I have to take the dish away, add in a little bit. Yeah. That's it. I don't think it doesn't do any harm.
The bond that I have with her, of course, does go back to my late wife, Angela. And the dog's presence there all the time when Angela was ill and ever since has been hugely important to me, because I was on, up to last year, I was on my own in the house, and there was 3 years, and Portia was always there and gave that kind of presence, even the little bit of noise. You know, she's not a very vocal dog, but she gives something there in a very silent but very powerful way. No bereavement is easy, but in my case, I think it made it much easier than otherwise, if I was on my own, I would have found it very difficult. That is the great value Portia has been to me, the huge significance in my life.
Yes. You're so sweet, you know that.
There will be a point that we need to say, you know, we can do something, but it's not the right thing for us to do. We should stop. And that is the toughest conversation that we will have, but it's important that we have it so that we don't put her through anything that she, you know, that she's going to suffer.
Oh my gosh, she's so perfect patient. See? Just like, oh my God.
I know he wants to do everything for her, and that he promised his wife, and we're there with him. We're trying to do everything we can for her as well.
Yeah, thanks, Abercon. Yep. Oops. Oops. I'm slim, you see. Once Portia becomes distressed or in pain, then it'll be very reluctant on my part, but I would be well able to decide to let her go when the time comes. Oh, Portia. Hello. How is she, all right?
She's all right.
As one neighbour of mine put it to me, she said, I think Angela is calling for her now. That's how she saw it. I thought it was a lovely way of putting it, that Angela wants to take her back. Yeah. You're all right, you poor old thing. You poor little dog. Huh? Well, you're stressed out. Huh? You don't like strange things, do you? No. No, but sure, you know them all. They look after you well, don't they? Yeah, they look after you very well. Now, wag your tail now, you'll be fine, okay? You're a good girl, aren't you? Then I simply have to let go at that stage. I'd be very sorry to, but that's life, isn't it? It is really a mystery of life and death, isn't it? You know? Yeah. Hopefully, things will go well. Then we'll take whatever comes.
She's more a climber first. She likes to get up to any high points in the house as much as she possibly can. She likes to wait there until you're walking past, and then she'll leap down and try to catch you by surprise. She has her sister terrorized. There was a couple of times where she managed to get up on top of the door in our bedroom.
Because I'm closer to that door and also to the desk unit. She's jumped on me in the middle of the night onto my chest. I think probably the first time it happened, I was probably quite terrified of her. Just wanted attention, basically, just wanted more cuddles.
Martha and Jason are collecting Shih Tzu Oscar after 5 nights apart, the longest time they have been separated. They can barely contain their excitement.
Can't wait to see him.
You looking forward to it, Oscar? Yeah.
Oh, I can't wait.
Can't wait to see him, yeah.
I can't wait to see him. I'm so happy that they fixed him.
Yeah.
I know he's going to be sore. I hope he's just happy to see us. And I say he will. Here he is.
Yeah.
Oh no, wait, no, here he is. Oh, no. Watch.
No.
Hello there.
Hey.
This is Oscar's.
Yeah.
Oh,
Yeah.
perfect. Hi. I just came with the paperwork and the medication first, because normally if I bring Oscar with me, you guys don't listen to me very much because of the happiness, okay?
You're probably right.
So Oscar had a surgery, as you know,
Yeah.
okay?
Yeah.
Everything went absolutely fine.
33 stones, is that a large amount on a dog?
Yes.
It is a huge amount of stones, but I think from all the possibilities, this was probably the best outcome for Oscar. So going forward, Oscar probably would need to go on a special diet to prevent the stones to form again. Because Oscar is not used to having any commercial dog food, there may be some kind of challenging times ahead, and I think the owner's not going to be very popular with Oscar.
Okay.
Here you go. Here we go. That's it.
If it can be easily fixed with diet, like, we're going to do our best to make him eat the horrible food, but...
Thanks for looking after my dog.
Thanks very much. Thank you.
We'll have to do whatever's best to keep him alive. We're going to stick by it, like whatever they say, that's it.
You're doing so well. I love you. I love you.
Hank has been recovering well from his castration surgery. His brother Joey has escaped the snip so far, but his time will come. And Keelan, of course, can't wait to see them.
I would be very, very attached to them. These are my babies. I mean, you know, I've had them since they were tiny, and it's just the nicest thing in the world to come home after a hard day and to have these gorgeous pigs there at the door waiting to greet you. I've really missed them. I found it difficult, really difficult, and can't wait to see them. Can't wait to see Hank, see how he got on. I'm nervous. I don't know, you know, you get these silly, is he going to blame you? Is he going to be, I don't know. I just can't wait to see them.
They're so good when they're tamed.
Keelan has never spent a night apart from his pigs since he got them. He's here with friend Emma for the happy reunion.
You recognise you, look, he's proud of you. Hi, so this is Emma.
Nice to meet you. How are you?
I'm good.
Hank is your pig?
He is, yeah.
Very good. Excellent.
No, it's not her pig. Hank's her baby.
Very good. Very good. All went well.
How are you? How are you doing? Huh?
It's always nice when something goes the right way. You sometimes take the good days for granted, and yeah, it's a routine procedure, it's a castration, it's not, you know, it's not brain surgery or spinal surgery and all this other snazzy stuff. It's, you know, it's a castration. There's no other way to describe it. But he went down well, he slept well, the procedure went well, he recovered well, and he went home. And that's all it is, the small victories that you have to take with you. And I tell the students that when you have a good day, remember it. And also it helps that they're super cute, so.
It's been the longest 5 days of my life.
So we've got to bring you home to see your sisters. Come on, guys.
In County Kildare, it's 10 weeks since the surgery to remove Oscar's bladder stones.
He's great. Yeah, he's all back to himself now. He's back to being the boss, as usual.
Yeah, he's really more of a boss because he really got spoiled, I suppose, when he was sick. Martha was cooking him special meals and
oh, yeah.
He was minded around the clock like a baby now. He was minding more than the kids. No sausages, bit of chicken some evenings mixed in dog food. We're trying to wean them off all that stuff because we're waiting on the proper food to come. And that's going to be very hard for Oscar because Oscar, when we eat, Oscar likes to sit beside me and have a little bit.
Yeah.
Doesn't matter what time we eat, where we are, he has to have a little bit with us. We put him on dog food and more veg. We're giving him a lot of veg now and that. But he is the glue to our family, like he makes us all like, you know, even with COVID and that when we're down, we just grab the dog and we go for a walk.
I can't believe how well she's doing. She has is in nearly 2 months of chemo now, and there are no side effects that I can see. No vomiting, no diarrhea, no lethargy, you know, other than for her age. She sleeps a lot anyway, even the breed does. But I'm astonished at how well she's doing. Certainly, I know a lot more about cancer than I did. I don't know, it hits, and it depends where it hits nowadays. In my wife's case, the stomach cancer it spread too fast, and they just couldn't keep up with it. But in her case, it seems to, because it's confined to this area here, and they were able to remove most of the gland and the cancer. So it's a matter of just keeping it keeping a clamp on it, really. There's a spiritual dimension to this, isn't there? And anybody who's very close to their dogs or cats will tell you the same thing, that there's something there.
Good girl. Good girl. Sophie, look.
Say hello to your brother. You haven't seen him, how good he managed to do it. When animals relax, it's just this big. Joey, you dirty pig, you.